Hello, everyone. Seeing the attendees over 30 currently. Um, Thank you again for joining us today. If you could just start by sharing your name and where you're joining us from, like your city or country, in the chat box, that would be great. A lot of geographic diversity here. It's great. We'll get started in about just 1 minute, just to let a few more people join. Um, if you just tuned in, if you could put your name and the country or city or place you're joining from in the chat box, just so we can get a sense of where everyone is tuning in from. Great. I think we can get this started. I see about more than 60 people. Great. Thank you. Hello, everyone, and welcome to today's webinar. Uh, Again, if you are just joining us, feel free to use the chat feature to add your name and the country or city or place that you're joining from, and maybe even what interests or topic areas brought you here today for this webinar. So my name is Alphonse Tam, and I'm the Global Communications Manager for ITDP, the Institute for Transportation and Development Policy, based in New York City. It's morning here right now, and I'll be introducing and moderating today's discussion with all of our wonderful panelists who will be sharing their experiences. So we can start with a few technical reminders for everyone. This session will be about 60 minutes, and we'll be having interpretations between English and sign language, specifically Indonesian Sign Language, which one of our presenters will also be using. But today's session will primarily be in English. We are also recording this webinar, and we'll make the videos available afterwards on ITDP's YouTube channel. And this will be mostly a moderated discussion, but with presentations from our panelists. But we might also choose some questions from the audience during the discussion. So feel free to use the chat box or the Q&A function, which is located on the toolbar at the bottom of your screen at any point. Great. So just to start with a bit of an introduction, and let me share my screen quickly for some of the technical things. Oops. Can everyone see my screen? No? I'll just do it this way. So just a quick reminder of the interpretations, the session reporting, and um, your toolbar where you can use the chat and Q&A functions. But just to give a background on the today's webinar and sort of the topics that we plan on covering. Uh, As you might know, this week, starting tomorrow, marks the third Global Disability Summit, which is taking place in Berlin, Germany. So we want to host this session at a really crucial moment when efforts are growing to increase the visibility of inclusion and accessibility issues. But of course, there's still a lot more work and transformation that is needed, especially when it comes to issues related to urban mobility and universal design. As you might know, data shows that more than 1 billion people all over the world are experiencing some form of disability, and about half of them live in cities. And in fact, most people will experience some form of disability during their lifetimes, whether it be clearly physical or mental or beyond. And as you might also know, it's often not a disability itself that limits people, but more the physical and political environments, especially in cities that we create that prioritize certain communities over others. So that brings us to today's session. Our teams at ITDP and our partners at the Transforming Urban Mobility Initiative, or TUMI, have been working closely to advocate for improvements to mobility for people with disabilities, specifically through raising awareness of challenges and opportunities, for more inclusive transport. So in the chat, I will add a few links to some of the most recent products that ITDP and TUMI have been working on, including a visual brief, which will have some upcoming translations, a video series that includes two of today's presenters, and an upcoming white paper. So I'll just put these links in here for everyone. If yeah, that you can take a look at on your own time. So it's essential for us to all continue advocating for decision makers and planners to prioritize more inclusive infrastructure. Um, so with that, we are honored to have all of our presenters today who will be sharing a lot of their own personal experiences with disability and also professional experiences from their work in various regions. And we all know that cities who are designed for everyone will socially and economically benefit all communities, not just those experiencing disabilities, but everyone who lives in a city. So first we have Cynthia Kipsong, who's a program assistant at the Flown Initiative in Kenya, which is a woman-led organization committed to safe and inclusive public transit in Africa. And then we will have Bright Owaya, the road safety advocate and a consultant in Kenya, who has a lot of deep experience working with road safety agencies and institutions in the region. Then we will have Mena Fathi, who is an active mobility associate with ITDP Africa, based in Egypt, who has been working on several accessibility projects for ITDP, specifically on gender inclusion for Cairo's public transit systems. And then finally, we have Bilkish Fitria Fabriani, who previously worked with the ITDP Indonesia team and is currently an accessibility advocate and a young professional based in Jakarta. Bilkish will be sharing her experiences using sign language, and the interpreters will be covering that for us into English. So we can start with some brief presentations from the presenters, and then we can dive further into the discussion. So I invite all of our panelists to also share links to resources in the chat. And then again, like I said before, if you have questions or relevant comments from the audience, please also put them in the chat. I think with that, we can start with Cynthia's presentation, which I'll be sharing on my screen. Great. And apologies for not being able to see my screen earlier. Hopefully it works this time. Is everyone able to see my screen? Great. I will hand it over to Cynthia.
Thank you, Tom. Good morning, good afternoon, good evening from wherever you're joining us from. My name is Cynthia Kipsang. I'm from Kenya. I work with an organization called FLOAN Initiative. FLOAN, we are a Pan-African women-led organization, and we have 10 years experience in implementing interventions, conducting research, and organizing dialogues in public transport. Our vision is a just mobility system. Um, Next slide, please. So we have four key priority areas in our organization. So one being research and knowledge generation, where we work towards providing evidence-based data to decision makers that inform advocacy and drive policy reforms in the transport sector. So far we have published 27 research publications, both on gender and disability inclusion in public transport, and these can be found on our website. Secondly, we have inclusive and functional public transport system in which our focus is to promote equitable, accessible, and safe mobility for all, with a focus on women, persons with disabilities, children, and other marginalized groups. Um, so, and the other key priority areas being policy engagement and advocacy, where we influence inclusive transport policies through strategic partnerships and advocacy efforts. And then lastly, health and environmental sustainability, where we work on strengthening the connection between environmental sustainability, public transport, and public health. On to the next slide, please. So for the purpose of this webinar, I'll be focusing on our Moving Barriers program, which is a program that focuses on promoting disability-friendly public transport service and policy. With this regard, we have worked on knowledge generation in disability inclusion in public transport. As you can see displayed here, so we have the accessibility audit reports. Um, we have features of disability-friendly BRT, research focusing on accessibility of persons with disabilities in the Nairobi metropolitan area, in which this study aimed to identify the technical, social, and policy gaps regarding inclusive mobility for persons with disabilities and the elderly. The findings from this research is what actually led us to conduct the ABC accessibility audit, which aims to provide evidence-based data on barriers to inclusion for persons with disabilities and recommendation based on universal accessibility principles. The other research that we have is the Moving Barriers and Increasing Access research, which is aimed to assess the mobility needs of women with disabilities and elderly women and understand the vulnerabilities that they face in accessing public transport. And lastly, we have the resource guide on supporting and interacting with persons with disabilities, which aimed to provide public transport operators with the knowledge and skills to support and interact with commuters with different types of disabilities. Next slide, please. So the other thing on movement building, we have worked on bringing together different stakeholders to champion for accessible and inclusive public transport collectively. So far we have the Moving Barriers Technical Working Group, which is a technical working group that is composed of 20 organizations of and for persons with disabilities. We also have the Disability Inclusion Champions, who are youth from higher learning institutions, where we work to strengthen their capacity to advocate for inclusive spaces and equip them with knowledge on inclusive public transport systems. Next slide. So lastly, our achievements so far have been continuously implementing some of the recommendations from the research that I've talked about earlier. So such as conducting the ABC accessibility audit, conducting electric vehicle accessibility audits, disability inclusion training to public transport operators to equip them with the necessary skills and knowledge on how to support and interact with persons with disabilities. Secondly, we have had increased engagements with policymakers and implementers and relevant actors such as road agencies and National Council for Persons with Disabilities here in Kenya, who have been instrumental in helping in implementation of some of the recommendations from our research. And thirdly, we have conducted advocacy campaigns with public transport companies, such as the Priority Seat campaign. So this aimed to assign designated seats for persons with disabilities, pregnant mothers, elderly people, and children. And lastly, we have been working to translate our publication into accessible format. So as of last year, we launched the Just Mobility podcast. You can check us out on our podcast platforms, on all the podcast platforms, Just Mobility Podcast, where we have translated the resource guide on supporting and interacting with persons with disabilities into an audiobook. Lastly, you can follow us. So these are photos from the electric vehicle bus accessibility audit and the road accessibility audit, where we engaged and involved the Moving Barriers Technical Working Group. And yes, you can, to get updates of our work, please follow us on our social media platforms and as well as our website on Flown Initiative. That is it from me. Thank you.
Thank you so much, Cynthia. It's great to learn a little bit more about your work, and uh, apologies for not being able to put the presentation full screen. For people who have been asking in the chat, something is happening with Zoom where if I use the full screen mode, it uh, shows up as blank for some reason. So for now, we'll just keep the presentations in this slideshow format. Great. Next, we will go to Bright to share a little bit more about her work as well, who is also based in Kenya.
Thank you very much. Good morning, good afternoon, good evening. Bright Oluwaya, my name. Currently engaged as a consultant for road safety with the Global Road Safety Partnership. My work in road safety advocacy and implementation spans around closely over 2 decades. I have worked with local NGOs, global NGOs, and also government. Currently, Global Road Safety Partnership, that is a hosted program at IFRC, International Federation for Red Cross and Red Crescent, supporting the grants arm, and in Kenya, there are some grantees, so supporting those particular ones, focusing on evidence-based risk factors for road crashes, and that's in a nutshell where I am from, and I'll be sharing my experience picked up from all those experiences. And I'm also the vice chairperson of the Association for the Physically Disabled of Kenya. I am a person with disability using a wheelchair, so that's the relevance of that. So I can get to the next slide. Yes, I come from a place of advocacy both for road safety and disability. So my work interacts a lot with both spaces. And from the disability perspective, as far as universal access is concerned, we do appreciate that there is a policy and legislative framework. As far as Kenya is concerned, of course, we have the global one, which is the UN Convention of Rights of Persons with Disabilities. And Article 9 is very explicit about inclusion. Then we have the Sustainable Development Goals, which guide us, 3.6 and 11.2, specifically explicit in provision of safe, affordable, accessible, sustainable transport for all, and especially for vulnerable situations like women, children, persons with disabilities, and older persons. In our country, the Constitution is again very clear in terms of inclusion. In the Bill of Rights chapter of our Kenyan Constitution, it talks about provision for inclusion to transportation, to spaces, so very explicit policy frameworks. And then there is the Disability Act of 2003, but has had an amendment recently, and that again speaks to inclusion, whether it's transportation, whether it's opportunities. So as far as paperwork is concerned, and as far as the policy framework, it looks good on our end, but the practice may not be very similar. So next slide, please. The next slide, it's not showing on my end. Perfect. The principles of universal access, again, like I said, are principles we identify with, and we are just looking at ensuring that all people, whatever their condition, have a free and equal access to all spaces and services and infrastructure. This, for me as a person, I know with experience of disability that universal access opens doors for education, employment, healthcare, social services. I always say that using transportation systems, we don't do this as a hobby. We do this because it's an end game, and the end game is this aspects of education, employment, healthcare, social interaction. And if this is opened up to everyone, it reduces dependency because people with disability are able to engage with society, to be able to go to school, become employable, work for themselves, gain income, and that removes them from the poverty space that most of them would most likely find themselves in. This is, like I said from the beginning, links very directly to sustainable development. So when we have universal access, we are actually actualizing the aspirations of sustainable development. So generally, accessibility, availability, affordability, and safety are very key things that we look at in terms of inclusion. Next slide, please. When it comes to barriers, why then in my work and where have I faced barriers? Policy and regulation. I'm not too sure that the policy and the regulations then totally embrace universal design principles. The picture on the screen, for those that may not see, it's a picture of me on a wheelchair trying to access a ramp to go over a bridge. But before you get to the ramp, there is a step that needs to be climbed. And for a person on a wheelchair, that becomes a space that I cannot access. So while a lot of money has been put in place in the budget for this particular bridge maybe, and the contractor and engineers and planners have sat back in on their desks and they know that persons with disability have been catered for, this is not a bridge I can use by myself because the barriers are very obvious that I cannot be able to get to the first the edge to get to the where the ramp begins. And when I do, the picture doesn't quite show, but it's a very long ramp that pushing myself across is very difficult. I'm not particularly a fan of bridges, and I might be talking about that a little later. Then there are also mobility issues that, and when I talked about physical, it's about land use. Mobility issues that hinder persons with disability from accessing transportation. We still do not have any public service system that transportation system that is accessible to wheelchairs. And that just means that people in wheelchairs, either you have to get private taxis or buy your own car, and that just adds to the expense of survival, considering the fact that most of persons with disability then are not exposed to income generation. So that just makes it impossible for them to actively participate in nation building. In decision making, again, persons with disabilities are generally left out because, again, if you cannot access physically, then you're not able to be at the table. And if you're not able to be at the table, that just means that whatever your views are not considered, and therefore you're continually left out as far as decision making is concerned. Next. That is just to go on. The picture that just came on was to go on to show some of the physical barriers that we experience. Yeah, let's just go to the next one. You had already gone there. So part of the advocacy work we do, and I know the pictures that will show up, I know that's not all. Using media has been a powerful tool in terms of advocating for safe spaces, in terms of advocating for universal access, in terms of self-advocacy. And what we would do is, as persons with disability, showing up ourselves and making sure that our voices are heard despite the many challenges, some of which I have already mentioned. And there are pictures below there of environments where accessibility has been made possible. That's part of our work that we did in collaboration with other organizations, one being Amend, the other one being AA Kenya, the other, and the project was financed by the FI Foundation. So just showing the possibilities of actually opening spaces. This is outside a school that has 3,800 students, and some of whom have disability, and they did not have any facilities to walk to and from school. And knowing very well, in most of the African countries, and in Nairobi, to be specific, or close to 50% of the people walk to and from either going to school, work, and other social amenities. Next, please. And I suspect I'm done. Thank you. Thank you.
Thank you so much, Bright. Yeah, it's great to hear the work that you're doing on sustainable development, as well as the importance of using the media for advocacy. As a communications person, I think that's very interesting. Great. And I think next we can hand it over to Mena from the ITDP Africa team, and I will share her presentation. Thank you again for bearing with me the technical issues with the screen share. Great.
Thank you, Alphonse, so much. Hi, everyone. Good evening, good morning. So, yeah, as Alphonse mentioned, my name is Menna Fathi from Egypt. I work as an active mobility associate at ITDP Africa. I will talk about how to improve women's access to public transport in Greater Cairo. Next, please. So, to give an overview about Cairo's streets and infrastructure, there is a very lack of safe infrastructure for women and children to access schools or public transport, and especially also for vulnerable groups. Next, please. And as the city also is trying to improve streets and improve infrastructure by widening streets, so this is actually will never ensure safety and ensure, I mean, walking and cycling in Egypt, especially for pedestrian crossings. Next, please. So again, if there are some existing footpaths, there are still they are even unusable, or sometimes they are encroached by cars or by some other infrastructure. Next, please. So even there are some, no, can you please go back again to the last, to the previous slide? Yeah, even there are some initiatives to build ramps to be accessible for all the users and for people with disabilities as well, but still even they are not in the well planned slope, or they are even unusable due to cars. They are obstructed by cars. Next, please. So unfortunately, the city is still build footbridges to solve the pedestrian crossings in the larger wide streets. So which increase actually the travel time and distance, and they are not accessible for all users, and also they are dangerous at night, especially for women. And even they build some elevators, escalators to encourage people to use the footbridges, but they are still not working, and they need a lot of money and a lot of maintenance as well. Next, please. So currently, we are working with the Ministry of Housing and Ministry of Transport, and to do a transitional plan to integrate some new public transportation, which is Western Corridor BRT project, to connect some parts of Giza and with the new cities, like in 6th of October city. And one of the main objectives that we have to ensure gender inclusion, and also to ensure accessibility to all the BRT stations for all users. Next, please. So from the gender study that we did, we found that 25% of public transport passengers are women, and over 80% of women that they actually face harassment at some stage of their journey. Next, please. So we are currently working to improve, as I mentioned, the last mile corridors to the BRT stations. So we wanted to create safe pedestrian crossings for all women, children, and persons with disabilities. Next, please. And also, we wanted to ensure road safety for all the streets in Cairo. So we are trying to build a physically separated footpath and cycling from carriageways, and also to ensure safety by reducing speed limits for all the streets access to the BRT stations. Next, please. And one of the main objectives that we have, that to ensure that apply universal access principles, and especially to ensure applying slopes with right measurements, which is 1 to 12 meters. Next, please. So yeah, next, can you hear? Yeah. So also to ensure safety and well-connected pedestrian walkway, we wanted to apply the zoning system, which is to divide the footpath into 3 main zoning systems to ensure safety, at least to have a pedestrian zone with at least 2 meters wide. And to have the furniture zone, all the trees and the street lights in the furniture zone. Next, please. And from also the surveys that we did during the initial studies of the BRT, that all the women wanted to have a mixed land use and to improve security. So women actually wanted the streets to be well lighted and to have shops, so to ensure safety for women to be all the streets used by women and children. Next, please. So we also wanted to have campaigns against harassment to encourage more women to talk about their security and to raise awareness for people about women's harassment. Next, please. And also from all our workshops that we did, we wanted to ensure that we included all the women and some people already. We invited people with disabilities to our workshops to ensure equity, diversity in all the planning process during our design and the planning process. Next, please. Yeah, thank you so much. I'm happy to have all the questions and to receive all the questions. Thank you so much.
Thank you, Mena. And if you want to put some links to some of the Cairo BRT or gender studies you've done into the chat, that might be good for some people to see. Thank you.
Sure.
And finally, we have Bilkish, who will be I will be sharing her presentation, but she'll be using Indonesian Sign Language to present. One second. And we will have interpretations into English.
Hello, everyone. Good morning, good afternoon, and good evening for you all. Okay, first of all, let me introduce my name. My name is Bilkish, Bilkish, and my sign name like this, above the chin. I am deaf, and I'm from Indonesia. And right now I live in Bekasi, but I work in Jakarta. And currently I work at Peruri. Peruri is Indonesia's state-owned enterprise or BUMN and responsible to print the money. And also for the passport. And also the cigarette tax, also they responsible for that. And the state-owned company is in Karawang. And then right now, I am the staff and for the procurement preparation staff at Pruri. And from my house to Peruri is quite far, from 1 hour, 1 hour far from my house. And I saw the transportation from Karawang to the Jakarta. It's quite far, and the accessible is quite good. And yes, the accessible from Karawang to Jakarta is really different from the center of the city. And then I have to go and go to the office and then back to our home every day. Can next slide? Yes. Before working in the Peruri, I had my internship program in ITDP, and then also I graduated in at Universitas Brawijaya, Malang, Indonesia, in East Java. And I had the internship for 3 months in ITDP. And in Brawijaya University, I gained a lot of knowledge such as infrastructure, transportation, and related fields because my major in urban regional planning. And I learned a lot about the accessibility transportation system regarding to the disability inclusion. And also for the pregnant woman and then for the elderly and all the vulnerability people. And right now, I'm working in Pruri. And actually, I didn't have the directly related major from my background, but I think it also impacted to the company as well. Thank you very much for the attention.
Thank you for that. I think it's great to also have experience from a country like Indonesia that has such an extensive public transit system where accessibility is really important for all communities. So with that, I'd like to dive a little bit into the discussion. And again, if anyone in the audience has any questions, feel free to use the chat function to ask any comments or anything else that's relevant. But I think we can start maybe with Cynthia, just based on your discussion on your work with gender and highlighting the sort of different perspectives and impacts of inaccessibility, especially for women and caregivers. Maybe you could talk a little bit more about maybe one or two top or challenges that women face in urban mobility and how this intersects with the disability community based on your work in Nairobi or in Africa in general.
Okay, thank you. Thank you for the question, Tam. So as I had mentioned earlier, in our organization, our main focus is on gender and disability inclusion in public transport. So we look at the safety issues, the accessibility issues, inclusivity issues around public transport with a focus on women, children, persons with disabilities, and the elderly. Looking at women's perspective when it comes to travel, it's very different compared to that of men. You'll find for women, there is a lot of trip training that goes into their mobility. So if you're a woman, most cases, in the morning you'll wake up, you have to go to drop your child to school. Thereafter, you go to work. After coming from work, you have to go do some shopping, all that, the trip training, meaning that there are a lot of, interaction with the urban environment. And unfortunately, in Nairobi or in the Kenyan context, the urban environment and the urban mobility system fails to cater to these specific needs of women. And throughout this whole experience of, multiple interaction and the caregiving responsibilities, you find that there are a lot of vulnerabilities that women are, exposed to. So issues of sexual harassment, gender-based violence when using public transport, even while walking or, cycling or just using the non-motorized transport. Issues of, sexual harassment, gender-based violence. And now when this intersects with disability, it makes it even, it heightens the vulnerability, because now there is discrimination not only on the basis of gender, but on disability as well. So based on the research that we conducted on assessing the mobility needs of women with disabilities and elderly women, we found out that there are significant social, technical, and policy gaps in the public transport system as pertains to Nairobi metropolitan area. First, looking at the inaccessibility of the infrastructure, the hidden costs that come with using public transport. If you are a person with disability and let's say you have an assistive device, when using public transport, at some point, in some cases, you will have to pay extra for that assistive device here in Kenya. In other cases, you will not be traveling alone. That means that you are with a caregiver, and it means that as you're paying your fare or looking at the cost of transportations, they significantly go high. And in other cases, people opt not to use the public transport system, looking at the significant barriers that are in place. So they will opt to use private means. And that means that this comes with extra costs that, as a person with disability, you will have to incur, or a caregiver to a person with disability. The other thing, looking at increase in sexual harassment in public transport. So you can imagine a woman without disability, how they are, they still are vulnerable to harassment. Think about, now a woman with disabilities. So these vulnerabilities are really heightened. And some of the other technical gaps are, like the inaccessibility of the infrastructure. This means that there isn't inclusive last mile connectivity. So public transport is only accessible along the road, the main highways. So you will have to figure out how you get from where the drop-off point to your home, and as well accessing, public transport from your home to accessing public transport from your home to where the public transport is being accessed. So that last mile connectivity is, a big issue. And looking at all those challenges, some of the key proposals and key recommendations that we provided is fair standardization, so that in the case where persons with disabilities, they don't have to incur these extra and additional costs when it comes to transportation. The other thing is training to public transport operators, because we realize that in the case where a public transport, there is a commuter or who has a disability, most times public transport operators fail to have the skills and the knowledge on how to handle and, to interact with them and support them throughout their commute. So trainings, of which we have been so much supportive in that, where we have offered multiple trainings to quite a number of public transport circles on how they can, interact and support, and also include disability inclusion in their, in their daily practices within the public transport sector. The other thing is policy implementation, and we have very good policies that are inclusive, but enforcement and implementations of these policies become such a huge challenge, and which they could be a game changer in the sense that universal design principles, when they are incorporated, it means that accessibility will be paramount, and public transport, urban environments will serve everyone. Those are just some of the few things that I can mention. More can be found on our research, and the link is provided on the chat. Thank you.
Thank you. Yes, and thank you for adding those links in the chat. Maybe Mena or Bright can add, since I know the ITDP Africa office has been working on the inclusion plans, as Mena mentioned, for the Cairo BRT. Are there specific things maybe in the kind of like planning and feasibility stages that you've seen working on the Cairo project that should be focused on to make systems more inclusive even before they're actually built?
Yeah, actually, the country is building new cities. Most of the new cities are actually car-oriented and centric cities, which actually build for men, and from car-oriented perspective, which are not promoting accessibility at all. So again, from policy perspectives and regulations, I think the country needs to integrate more of the transit-oriented development strategies and principles into the urban planning policies, and not only for the design. Also, the political will is very important to encourage more of the ministries and local authorities and administrations to have the awareness and the importance, to feel the importance of integrating and applying even the universal design principles and access to the not only to the design phase, and not only for the planning or design phase, I mean, but even in the implementation and construction, and to have a monitoring and evaluation criteria, and to follow up even with the after the design. So it's not only about the design, it's again about the building regulations to be adopted and to be more inclusively oriented, and also is the monitoring and the evaluation. So this is actually very important to be considered, and awareness is really important also, as we are working on the awareness perspective. So the awareness and the campaigns, and to have streets for all, and to have like promoting safety and security, even also again to the Egyptian standards and laws, to slow, or I mean not to slow, I mean to incorporate the design speed limits for in the design codes, to have like a design speeds limits. That will be also very important, and will be to ensure safety and accessibility for all users.
Thank you. I think maybe Bright, given your work on road safety specifically, if you have anything to add in terms of the importance of not just designing roads through physical infrastructure, but also policies to ensure safety around transit corridors.
Yeah, indeed. Just like Cynthia and the other presenter has mentioned, it is of no value to have progressive principles on paper, and yet a good number of a big population has no access. First and foremost, I just want to say that inclusion and access must begin to be viewed as a rights issue. Really, it is a rights issue. Everybody in Kenya kind of pays taxes in one way or another, So persons with disability, the elderly, the children, the ones that really are disenfranchised, they need to be part of. And the missing gap that I see a lot is inclusion in the planning stages. So it's not so much just about the delivery, it is also about the process. And I find that the process is very discriminatory, and that is why you find a lot of retrofitting. That is why you find a lot of change of plans in terms of after you've had the interventions. Like I was showing you in the earlier picture, you have a bridge and you discover that a person on a wheelchair cannot access it, so you're using more resources. So there is much more that needs to happen in the changing of the paradigm, so that we look at inclusion not just as movement from one place to another of a person with disability or other vulnerable groups, but it is also about inclusion in the process of ensuring that this whatever it is that we're implementing is at work. The other thing that I find has a gap is in terms of a policy can be put in place, but it stops at that. There's no regulatory framework to really help operationalize the policy. So you find, for example, like the Nairobi County non-motorized transport policy is very rich, and if it is implemented to the full, it can begin to treat some of the problems that we see in terms of access, in terms of inclusion, but there's no clear framework in terms of how that happens, because the policy is there, but what activates that policy is now the regulation. It's the same thing with the Traffic Act. There is a very good law, for example, around accessibility around schools, but regulations haven't happened. So as advocates, that's what we focus on a lot in terms of just engaging, in terms of campaigning, in terms of, I think Cynthia mentioned training, so that the essence of inclusion is not just an add-on. It's not like an accessory. It is part of the main. So maybe that's just what I could add from what the rest have said.
That's great. Thank you. Yeah, I think that's such an important point. So often we focus on the physical infrastructure, and there's obviously much more systems-based work that needs to be done. I'd like to direct a question to Bilkesh, and from your experience with Transjakarta specifically, who, as we know from our work with ITDP, is doing more on activating inclusive interventions on the systems, specifically for people with hearing or visual disabilities. What has your experience been? And knowing that a lot of these new interventions are technology-based, how do you feel as a user things can be progressed?
Maybe the first of all, because a lot of people in our country, first, I am a sign language interpreter, so I really hope there's not just speaking like announcement in the voice announcement, but actually the tax announcement, because some of in transportation transportation in Jakarta is a lot with the speaking, like a voice information, but not in the text information. So because I'm deaf, I can't be hearing them. I can't be hearing where the station and where we are to go. And sometimes I'm text people like where it is. But we can say one of the transportation like MRT or LRT, it's a really great actually, because they have the technology and they have the text about the announcement, but not all of the transportation of Indonesia. But I think we improved that. But in great transportation in Indonesia, we can say this just in Jakarta. a center of Indonesia, but we can't see in other place or in other city. Whenever I'm go to work, I always use my my work bus, and I think this is helped me as a woman and disability. So they always help me to where I want to go and use the transportation, public transportation too. Thank you.
That's great. Thank you. It's important to have that perspective as a user specifically. I know we only have a few minutes left, but I'd like to just ask the group, especially again with the Global Disability Summit happening this week, what would your number one priority or recommendation be to the stakeholders or kind of like policymakers at a global conference like this? Since we have Bilkish on screen, maybe she can go first.
Sorry, which is first, Bilkis?
Yeah. Just what would your top policy like recommendation for decision makers?
For my sorry, can you repeat again for your question?
Just what would since there's the Global Disability Summit this week, what would be your number one kind of priority to decision makers in your region?
For my opinion, actually the best thing, specifically in Jakarta, we can say it in MRT and LRT, because the technology, like I said before to you, there is really great, because as a deaf person, I can see the text announcement, but for the others, I hope they will can improve the same in Jakarta. So it's not just one center or in Jakarta, but I hope in around of Indonesia, they can give accessible like MRT and LRT. It's not Jakarta, but around Indonesia. We hope that. I thought that is important.
Thank you. I'd like to ask the same question to the other panelists, maybe Cynthia or Mena or Bright. We can start with Bright.
Yeah, okay, all right. The one thing I would say is change your paradigm shift. Having inclusive environments is not a favor, it's a right, and that can be done very quickly. For example, by just leveraging on existing infrastructure and resources to bridge the gaps, and also fully implementing the existing policies, enforcing the laws that already exist, but most importantly, putting in place policies that mandate universal design principles, because when you have universal design principles, pedestrians, cyclists, people that are walking, people with disability, women, children, everybody's potential is unlocked, especially for people with disability, so that they can engage more meaningfully in society. So really looking at your population, the people you lead as policy makers, just open the doorways, and it's as simple as just using existing resources and also just having the right principles in place.
Great. Thank you so much. Cynthia, I saw you unmuted.
Okay, thank you. For me, my recommendation would be a move from policy to action, so that we can have an inclusive public transport for everyone. For policymakers is use of like leveraging on disaggregated data, because to inform policy interventions or even actions, it means that it should be coming from an informed point. So what are the travel patterns? What are the behaviors, diversity of the people that you are planning for, so that at the end of it all, we have an inclusive urban environment, inclusive public transport systems. Yeah.
Thank you. Mena, you can have the last comment if you have anything to
Yeah,
add.
thank you so much. Yeah, I think for Egypt, especially because there are still lack of enforcement of laws, and also also some of the standards do not include universal access principles. So it's important to still regulate and enforce accessibility standards in all the on all the standards and laws, and not to work as a patchwork, to engage all the relative stakeholders in all the phases in a very real way. Yeah, this is actually very important still in the Egyptian standards and regulations, and not to get benefit. I mean, like, it's still when we are having some negotiations with the government, like they mention like what will be beneficial in terms of cost or revenue from maybe building a safe infrastructure. So sometimes not everything have to get benefit, or I mean, not in terms of revenue or in terms of money. No, so some statements have to be just for the right of all, and right to be for the all the people. I mean, it's in terms of rights. So yeah, thank you so much.
Great. Thank you so much. And I'd like to thank all of our panelists for their time and for sharing their experiences. Obviously, there's so much more to the conversation. And unfortunately, we can't cover all of the topics, but it's great to just hear from your personal and professional experiences. And I invite everyone to take a look at the links that were added into the chat for more resources from all of the groups here, and also ITDP and TUMI as well. And again, this recording will be shared on the YouTube channel, and possibly all the presentations if the panelists are okay with sharing those as well. So be sure to follow ITDP on social media or our newsletter for more upcoming events, especially as we celebrate our 40th anniversary this year. Thank you, everyone, for tuning in today, and have a good day. Bye-bye. Thank you.
Thank you. Bye.
Thank you, everyone. Bye.